Hello, today is Friday, May 21st, 2021. My name is Evan Solis. I'm interviewing Gustavo Rivera for the Voces Oral History Center at the University of Texas at Austin. Please know, Mr. Rivera, that this interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 3 questions we need to make sure you agree to before we go on. 1, Voces wishes to archive your interview along with any other photographs and other documentation at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials you donate to Voces. Do you give Voces consent to archive your interview and your materials at the Benson Library?
Yes, I agree.
Thank you. Do you grant Voces copyright over the interview and any material you provide?
Unless there's something particularly clever that I might use elsewhere, I agree.
Okay, well, that'll be fun. Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Fantastic. And then 2 more questions. We have many questions in a pre-interview form that you and I have just filled out. We used that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server. Before we send it to the Benson Library, we would have stripped out any content information for yourself, your staff, or your family members. So that's not going to be part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview, that is that pre-interview form, in your public file available to researchers at the Benson?
Yes, I agree.
Fantastic. And the last one, on occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
All right, fantastic. Well, that's that. So, Senator, thanks again for your
time.
All
right, we're good. All right, bye.
Very informative. So, we want to talk about a lot in this interview. It's for the Voices of the Pandemic Project, as I mentioned. But to just start off, I'd like to ask if you could please, in as many words as you want to, give us some background on you, who you are, where you're from, and what you do.
My name is Gustavo Rivera, or my full name is Jose Gustavo Rivera Rodriguez Ortiz Lopez Arroyo Guzman, although you don't have to use all that, obviously. Gustavo Rivera is what I go by. I'm a state senator in the 33rd District in the Northwest Bronx. I've been a state senator for the last 11 years, so stay off my lawn. Kind of reminds me how old I am. I'm originally born and raised in Puerto Rico, came here originally to do a PhD in political science. The fact that I do not introduce myself as a doctor or a PhD tells you how far I got. Did teach college for a while, though. I still teach part-time every once in a while. And I done a bunch of stuff in politics and government. I worked in the New York State Senate for a while before I was a senator. And I'm sure that we will talk about other details, but I've been a state senator for 11 years, currently the chair of the Health Committee in the Senate. There's that.
All right. Yeah, there's a lot that we'll go into more detail there. We'll start, like I mentioned, first with COVID, though, since this is for the Voices of the Pandemic Project, and we'll just get a broad panorama sort of your experiences during the pandemic. And the first question I want to ask you is, if you reflect now on over a year ago, and I'm assuming this happened since you live in, what was really the first epicenter, was there a moment, or what was the first moment that sticks out in your mind as when you realized, this pandemic, this COVID thing, this is going to be a very serious thing. This is not just going to be a sort of, 1 week issue. This is something that is going to change our lives. What was that? What made you realize that, and just sort of how did that go for you?
Don't exactly remember the date in March, but it's probably the second week of March. There is a lady who was my partner, and we've been together for a while, and her father is a retired epidemiologist. And so, and she also goes by they. So they are some of the smartest. They are one of the smartest people I know. And I remember that after reading something about what the pandemic, what coronavirus was, et cetera, and reading about some of the stuff that was happening in other places, particularly in Italy at one point, I remember sitting down and talking to her, and then they laid out what eventually, basically everything that's happened since, but there was they are not prone to exaggeration. And so when she described how this thing is potentially going to spread, even though we had limited information at the time, how it potentially was going to spread, how serious it needed to be taken, the type of impact that it would have on the healthcare system, it was the first time that I really kind of smacked me in the head. That was a Wednesday. On Thursday, I came into my office to talk to my chief of staff, and I told her we're closing the office for in-person meetings tomorrow. I was the first state Senate office in the Senate in the state of New York to do that. So I would say probably second week of March was when it started to really kind of take another shape.
That's interesting that it's like a personal connection, that it was a personal connection for you. I would have imagined being in the Senate and especially being the chair of the health committee, that you would have, were you privy to information in those early stages that maybe the rest of the public wasn't getting?
A little bit, but not much. There's a whole other side. There's a whole other, side conversation that we could have about Governor Andrew Cuomo in the state, who everybody loved. You should, and I want to make sure, since this will live on forever, I just want to say a couple of things. Cuomo is not your boyfriend. You do not want him as your boyfriend. You could do so much better than that. And if you consider yourself a Cuomo-sexual, it is the only sexual orientation I will judge you for.
He's so handsome, though.
No, he's not. He looks like a gargoyle. Let's be real. But in all seriousness, so there was. I'm just saying that to say there was a lot of information that the governor had that was not shared with us in the legislature. Even those of us who are in positions that we should be informed and included in conversations. There was he's being investigated by various agencies for a lot of things that happened during this time and that he handled differently. The point is that up to that point, we had seen, the things that we had seen had been not consistent. This was a week after the first, the governor made a unilateral decision to take one small city just north of New York City in Westchester County and shut it down. And just basically he made it up out of whole cloth without including anybody of the local electeds. They were kind of surprised like everybody else. And so we were like, but what are you doing? Why are you doing this? Where are you getting information? He didn't really give us that much information. So it was the first time when I spoke to my lady, when she kind of laid it out and said, went even to the, from the epidemiological perspective, right? That this is a respiratory ailment that we don't know yet if it can be aerosolized, that it will spread quickly, that it could be such a serious, the impact that it can have because it can spread so quickly in large groups. All these things started to become wait a minute, we have to take this seriously. I didn't know how bad it was going to get, but I was that was the first moment. So for me, it was that, making that connection and saying we are in a moment. By the way, at that exact same moment in the political process in New York State, there's something called petition gathering. Now, you know what petition gathering is. It's a little bit different in every state, obviously, but in the state of New York, to get on the ballot for a primary, you have to gather petition signatures from voters, and so and that means people knocking on people's doors, carrying a petition sheet with a pen that is touched by 1 billion people while going up and down stairs and huffing and puffing. So that was happening at the same time as I was one of the first people who said, we need to get rid of that process. We can't have that process happening. I was not successful. I was somewhat successful in getting it kind of, pulled back. But I tell you all this to say that, yes, for me, it was having somebody who I respect, who had knowledge that was expert, being given to them, and then them imparting that to me gave me context of saying we need to do things differently. So the first thing we're going to do in my office is we're going to close down and we're going to work. Everybody's going to work remotely immediately. I'm going to ask the Senate to do the same as quickly as possible. I was trying to get us to introduce a piece of legislation to actually change the petition process. But it stemmed from that.
Yeah, a lot of little branches off that I want to ask you
Yeah.
about. I guess like the first, so in those immediate days, or can you just describe to us, for those of us who don't know and those who will be listening or researching who don't know, so like what in your capacity as a state senator or in the capacity of the New York State Senate, like what tools did y'all have to respond to this crisis? Like, and what did y'all have to do like in conjunction with the General Assembly and the governor's office? Because obviously, like you're saying, Cuomo became this supranational figure. He had all these powers, it seemed like.
Yeah.
But did y'all have to grant him those powers? Was that like something he had inherently? How did all that work like when you're responding at an institutional level?
Okay. Yeah, I did go get water. I should go get rum because it seems that we're going to go down this road. If we're going to go down this road, I'm probably going to need some liquor. And you might be having some right now in that Cowboys mug of yours. Anyway.
Well, I'm going to edit that out though.
I don't care. Like, please keep it in there. My love of rum should live forever and ever. Like, this is not a secret. This is not something I keep a secret. Anyway. Okay. So yes, you're right. There's a lot of stuff there. In a moment of crisis, the executive is built to respond quicker than a legislature. By default, a legislature is a deliberative body, and some work more effectively than others and more efficiently than others. But every legislature is a body made up of a lot of different people, have a lot of different interests. We have to line them up. You have to, and in the governor's office or a mayor or a president, an executive is built to respond to crisis. So I was of the belief that there were baked in powers that the governor has still that are constitutionally given that give him the authority to deal with emergencies, as he has done in any time that there's a natural disaster, there's a flood, there's there's an earthquake. I mean, we don't get those in New York, but something like that. So if there is a natural emergency, a natural disaster, or some other sort of emergency, there are baked in powers that the governor has already in the New York State Constitution. In the beginning of March, and I wish I had it here because I had a physical calendar, like one of those big ones you put on your desk, where I started putting in all these dates. I did it afterwards for a set of hearings that we had with the Department of Health related to deaths in nursing homes. Maybe we'll get to that. But but I don't have it right now because the federal government has it. Because I have been interviewed by the FBI and by the Eastern District of the U.S. Attorney's Office on an investigation on good old Cuomo. So they don't have that. I don't have it right now. My attorney has it. He's like copying it and giving it to them. But I refer to it because there I put all these dates. And I could tell you the date that they voted, that the governor asked us in the state to give him a set of emergency powers. Like he said, all right, we need a couple of $1 million. I think it was like $5 million or something like that. We need that as emergency funding that the legislature needs to approve for COVID, for COVID, related activities. And we're like, yeah, sure. Put it, let's go. Let's do that. Oh, and by the way, on top of that, I'm going to need emergency powers. And we're like, wait, what do you mean? And we started looking at them and we read it. And I remember one of my colleagues who tragically ultimately voted for it. I was one of only 13 legislators in the entire state legislature in New York that voted against it. There's 150 assembly members, 63 senators, so 213 people. There's 13 of us that voted against it. Everybody else voted for it. But he was saying, I want extended authority. I want to be able to issue directives that do not need any type, that don't have any type of oversight by the legislature. And I need that power. And many of us were like, no, he doesn't. That shit is baked in. He already has powers that are baked into the New York State Constitution. So we don't need to give him these powers. But ultimately he succeeded. And for months, we ultimately took them away from him roughly a year later, just a couple of months ago. And I was consistently speaking against them. Against these extended powers. But he, under normal circumstances, is secretive, very micromanaging. And on a crisis like this, which again, I recognize that executives are built for crisis. They can respond quickly when something is necessary. However, particularly as the shit dragged on, The idea that he would not include the legislature and that he would basically ignore any concerns that we had, any requests for information, like that's just bananas. And we had hearings where we called him on it. We publicly called him on it. And now he's getting investigated by various agencies on some of the stuff that he did during that time. So there you go.
Can you give like a specific example of in those early days, maybe after that, you know, those extra emergency powers have been granted to him. An example of maybe something that you felt like, okay, why is he doing that? Like why, like we could be a part of this as a legislature, but because we passed this, we don't like, can you just give us like an example?
I'll give you two or three of them. And let's start with two things that everybody across the country knows. And vaccination, right? One at the beginning of the pandemic,
sorry, Senator, you
one
cut out.
towards
I'm
the
sorry.
end.
Can you hear me?
Still,
you cut out real quickly. It looks like, yeah.
I'll say two things. So two things that everybody knows something about. At the beginning of the pandemic, testing, and near the end, we're near the end now, vaccination, although there's a lot of that, we still have some ways to go and we're not out of the woods yet, right? And you're in Texas, God bless you, my brother, because whoo, I have a good friend of mine who's a state legislator over there.
Really?
Yeah.
What?
Mariana Gonzalez.
Hmm.
She's the top Democrat in the Appropriations Committee in the Texas State Assembly.
Mm-hmm.
She's a fantastic, just a sweetheart, and you should probably. She's a queer woman of color, trying to do some good things in the Texas State Legislature. So you know she's a goddamn hero.
Yeah. Good Lord.
She's fantastic, and she's such a sweetheart and such a good person, and she's going through some shit right now because of the fucked up things that Texas is doing. But regardless.
Yeah.
So testing, vaccination. Testing. Now, to back up for a second, one of the things that I've been consistently talking about, and I'm not the only one who's done this, but many people have consistently for years talked about healthcare inequities, right? As somebody who I've been the chair of the health committee for the last couple of years, I've been the ranking member before that. And it's one of the issues, health and public health is one of the issues that became kind of my centerpiece of focus legislatively. And one of the things that's consistently obvious to many people, and certainly became more and more obvious to me, was the healthcare inequities that kind of baked into the system. And how, when you have, it's said that when you have, when the system has a cold, there's particular parts of the system that have like a flu, and so in the Bronx, the county that I live in and proudly represent, out of 62 counties in the state of New York, the Bronx, according to the Robert Wood Johnson Foundation, has like for 9 years in a row found that the Bronx is the unhealthiest county in the state of New York. High rates of obesity, heart disease, hypertension, you name it, food deserts, all sorts of things, right? And there are many things that are baked into the system. And so I mentioned this for context. Immediately when I had a better understanding of what this is, of what this virus is, the fact that it's respiratory in nature, the fact that you get it by breathing it in, you get it by being in groups of people, you are more at risk if you are diabetic or asthmatic, older, that type of thing. And then I started thinking about there are people, I am immensely privileged. I actually did my job from right here for 98% of the pandemic. The people who I represent, they didn't have that. Many of them didn't have that ability. First of all, they had to go to work, because they wouldn't eat. And when they had to go to work, they had to get on a train, an enclosed space. They had to go to the city. They had to they had to continue to do things to put them at risk, right? In that context, when there's healthcare inequities that are already built into the system, there's many of us that were saying loudly, and this is, again, from my understanding, a lot of it stems from that conversation. And one of the things that I was asking her, it's like, so what are some of the policy things that we need to do? And she says, we need to increase testing by a lot, because we need to identify where this thing is happening. And we need to have effective contact tracing, which we never really did, not in the state of New York, at least. We eventually got to it, but it wasn't as effective as it needed to be. But so right at the beginning, it was like, all right, then we need to expand testing capacity by a lot. There were limitations at the national level, right? Because we know that for a while there was only one laboratory that was testing everything in the country. It was the one in the CDC in Atlanta. So it meant that you in Texas, you got perforated in your friggin' brain. That thing had to go into a little baggie and get put on a damn plane or a truck to go to Atlanta. Or for me here, someone in California, Seattle, same thing. So right at the beginning, and then you had an administration at the national level that could give two shits about actually mobilizing national resources for a national crisis. So it was a perfect storm of sorts. So in the state of New York, there were limitations, certainly, but there were many of us that were saying initially, as we must increase testing capacity in places that we believe are going to be more harder struck. These are poor working class communities that live in congregate, but there's also cultural issues, right? Where there's cultural and economic issues where you live multi-generational families living in the apartment that I live in. It's a 1-bedroom apartment, right? I live here by myself. The people upstairs, it's the same apartment, right? 5 people live upstairs. That's normal in this neighborhood and in many neighborhoods in poor and working class communities across certainly the country, but certainly in the city. So we knew that shit was gonna be bad. And so we were saying, testing. We need to expand testing. So what did he do? Instead of working along with public health departments all across the state, many of which, like the health department in the city of New York, which is one of the premier public health departments in the country, they are prepared for this sort of thing. They have plans for this sort of thing. So you could say, okay, so you have a plan, city of New York, you have a plan, county of Westchester, you have a plan, county of Nassau. Okay, let's work together so that the state can augment the plans that you already got, so that we just get up and running, and we put the places that require testing, because that's what we're talking at the beginning, in communities that really need it, right? That's not what happened. What happened was that the governor wanted to only do things where he could actually take credit, where he could be the conquering hero, where he could appear in state-sanctioned facilities. Sometimes what he did is he put, for example, near my house, right? Near my house, not that far away, is Lehman College, which is a city university school, City University of New York, which means it's a state school, right? It's a state because it's a city school, but it's a state school, except it's in the city, right? So, but it's a state college. So they have a big parking lot. So what this guy do? He set up this amazing, big, huge drive-in testing center at Lehman College, just a couple of blocks from my house. People couldn't walk up to it. You couldn't do walk up. You had to drive up. 90% of the people I represent don't have a goddamn car. And you had zip codes, particularly in my district, just south of that were high rates of hospitalization, high rates of deaths. And these people couldn't get tested. Because when the capacity for testing was going up, who was the one that determined where that capacity was utilized? The state. So as opposed to working along with county departments of health, which already had plans, because this is what the fuck they do, instead of doing that, it was about, how do I do a little event? Oh, no, I'm sorry, not a little event, a big event where I can appear as a conquering hero, where I could be like, there could be a big sign behind me and people could be there and people could applaud me. And I could say like, look at all I'm doing, point to that. This is the main issue. So we could have said anybody, and then months later, as the rates of hospitalization and the rates of deaths clearly happened in places where poor and working class people were. So it's our folks who got sick. It's our folks who got hospitalized. It's our folks who died. And this fucking guy then says, oh, those numbers are interesting. Okay. We should look into that. We could have told you. Matter of fact, we did. So that was in testing. And then fast forward almost a year later, when the vaccination issue started popping up, exactly the same goddamn thing happened. As opposed to the state working along with county departments of health, which again, have a plan. The city of New York, I have a conversation, it's a few months ago, when the vaccination shit, I'm getting riled up. Apologies. So you have the vaccinations are starting to ramp up, right? We're starting to get vaccinations out. And we don't have clarity on how they're being rolled out, like what are the parameters, where people can actually get them, like all these sorts of who's eligible, who's not eligible, etc. Excuse me. The state's the one that determines this almost on a daily basis. So I call the Department of Health and the leader, the majority leader. So we demand a meeting with the Department of Health of the state of New York. And so the conference gets together for a meeting, and we have a Zoom, right? And so the commissioner of health sits on a Zoom thing on a big table with like microphones, and he's got the thing, and he's in those presentations, basically the same place where this motherfucker did his press conferences. So he sat there, and then he started to basically give us a presentation about what the disease actually is, and then how the vaccines were developed. And I'm texting the intergovernmental people for the governor, like, what the actual fuck is this? This is not, we don't need any of this. I'm glad that you're telling us about the development of the vaccines and how RNA vaccines work as opposed to other types, but this is not what the fuck we're here to do, okay? That we're here to ask very specific questions about what communities, poor working class communities, people of color, who are the ones who were dying and the ones who were hospitalized, and many of whom have issues trusting you or have issues trusting government, period. And we're doing the work to try to get them to a place where they will get the fucking shot, but we need the shot. So you need to answer questions about that. And we had an hour-and-a-half conversation that was just frustration upon frustration upon frustration. Nobody walked out happy of that because we got no goddamn answers. The next day, I and my staff had a conversation with the commissioner of health of the city of New York. And within 5 minutes of starting that conversation, he had given me far more information than I got from this motherfucker the night before. Because he said to me, so the Department of Health, this is what we do. We train for this. So we've thought about this. So we've thought about locations. We've made determinations. We made analysis based on zip code level. What are the zip codes that have high rates of hospitalization and death? We've identified locations in those places. We've already spoken to the folks who own those locations. We've identified locations that can be ramped up so that as the eligibility is expanded, they can actually go from just doing 2 or 3 people at a time to doing 15 people at a time to doing 50 people at a time. We've already figured out where they are. We've got so they figured out all this thing, and they're like, but we can't really do any of that unless we get the vaccines and we get clarity from the state about who we can actually get them to. And I was just, so that is the level of frustration that I'm talking about. So maybe there was just there was a lot of expletives in that too, but this is what you get if you talk with someone from the Bronx. That's what it is. Bottom line is that what you had, and this is just 2 instances, but it is emblematic of how this fucking guy functioned during this entire thing and how he still does it.
Yeah, I would. So I'm not done. I want to hear more about sort of the failings or your perspective on the failings of the response to this in New York.
How much Cuomo is a garbage human? You want to hear more about that? I got many stories.
In your words, yeah, I was interested to see how this was going to go actually beforehand, but taking a very interesting route. But so
I can be boring if you want.
No, not at all, please. But before actually, because you mentioned your district, you mentioned your apartment, these what we've seen, these cultural practices that are prevalent among Latino communities across the nation that have contributed to Latinos being overrepresented in deaths and infection rates, et cetera. So I'm wondering if you can talk a bit about your district specifically, how it was affected, how your constituents were affected, and also you're talking about. I'm getting a sense of almost like impotency, there's this government, there's this executive branch that is, in your view, mismanaging things. But so what were you actually able to do, especially not just, as a senator and you're looking out for the interests of the whole state, but for your constituency, when you reflect on the past year? So 2 parts of that question, long story short. your constituency, your district, what does it look like? How is it impacted in those like first days? And then how are you actually able to like to help them?
So my district is in the Northwest Bronx. It is about 330,000 people. It is almost 60% Latino, made up of different nationalities. I represent, and this is why I told you this earlier, but just so it's on the record, the Puerto Rican flag is there because I was born in Puerto Rico, but the Dominican flag is there because I represent more Dominicans than any other state legislator in the country, as they had gotten priced out of, they moved out as the Dominicans moved out, they moved up to the US, they moved to New York, they moved to Upper Manhattan, and as they've gotten priced out of Upper Manhattan, they've crossed all the bridges and wound up in the Bronx. So I represent a lot of the Ifuna community, which is an indigenous and African American community. There's a very fascinating mixture that developed.
I'm sorry, you cut out just a second. What was the name of that community you said? You said another.
The Garifuna. The Garifuna.
Oh, Garifuna. Yeah.
Yeah, the Garifuna. And the Garifunas are very, it's a fascinating mix of indigenous folks from Central America who mixed with slaves, who were survivors of a shipwreck. And then they developed into a whole culture in Central America, Honduras, El Salvador, that area. And many of them live in my district as well. There's a growing community of West African folks as well that live here. There's Puerto Ricans as well, a growing community of Mexicans. So it's an incredibly diverse district. It is poor and working class. Median income is about $30,000 a year in 2021 in New York City. It is, high rates of unemployment. It's a district that is definitely is challenged, right? And as I said earlier, because I am very much aware of the health inequities that exist, I knew that it was going to be bad, and indeed it was. There was one zip code in particular, 10458, which is just south of me, which was particularly bad at the height of it. And you probably heard about this. You probably heard anecdotes about it, but it's absolutely true that there was one point in late March, early April, where every couple of minutes there was an ambulance. Like every couple of minutes there was an ambulance. It just became kind of this, the sounds of the city, which I usually love so much. They were just like all the time. It was really scary. And so, and then as I stated earlier, many of these folks, they continued to go to work during the pandemic because they didn't have a choice, right? So if they could keep their jobs, then they kept doing it. And some of them are, because when you're talking about essential workers, you're not only talking about medical folks. You're talking about folks who work in supermarkets, folks who might work in restaurants and kitchens. These are essential workers, although they might not be treated as such, right? But they had to go to work. So because they didn't want to lose their job, everybody was losing their job. They still had to keep theirs if they could keep it. So they kept going to work, which means that they got infected. Then they came back home. As I said earlier, multi-generational families living under one roof. People got it. It was harder for them to like when they tested positive, if the testing capacity was there. But for months it really wasn't. Once the testing capacity was there, and then they started finding out, then in the best case scenario, then what you do is you separate that person from whatever family members they might live with, right? They go in quarantine. These folks don't have like big houses that they can go to one end and the other people live in it. Like they couldn't do that. It was like they had a living room. There's other two people sleeping in the living room with them. So what we did, well, as I said, we went virtual before anybody else, before any other state Senate office or state assembly. We closed. We went all virtual. We set up a system where you could still call the office and it would always bounce to somebody's phone. We established a database of resources that we reached out to the local nonprofits, kind of see how they were doing, and tried to make sure that we knew what resources were available so that people needed them, they could be directed there. We tried to get, whenever we could, to augment the capacity of some of these folks to be able to do things like whenever we were able to identify masks or food to give to people who will distribute to folks that are most vulnerable. But it was rough, dude. It was rough. And I actually, I didn't lose family members, but I did kind of. There was a former staffer, good friend, who used to work in my office. Weirdly enough, he was one of my mentors, when I was a little younger. He worked in my office for about a year. And then he didn't work in my office after that, but we still had friends, and he passed away from COVID. And then one of my senior staffers, brilliant woman who was the director of my health committee, that she passed away in December. She doesn't live in the city. She lived in upstate New York. But anyway, that's the first person. He did live in my district, and so he was one of many folks that passed away. So it was rough, dude.
Yeah, when you're talking about it's those ambulances that you were hearing, I remember reading like those stories and seeing the news about how much New York had like become this sort of just like post-apocalyptic scene for in a lot of ways. Your district, like being so diverse, I'm wondering how culture was a part of what y'all were considering when like reaching out and helping folks. You've got Dominicans, Puerto Ricans, Garifunas, like different folks, like here and across the country, people I've spoken to, I've heard that in a lot of cases, it was hard just to get Spanish language information out there, for a lot of time. And obviously that enough isn't like, it's probably not enough to cut it, like to like effectively communicate with someone, but just like living in such a diverse district in this moment of crisis, how do you engage with these different communities, or how do you manage that? Like, what's the nuts and bolts of that look like?
The nuts and bolts of that looks like having a good idea of the organizations who serve them. We've been, I'm lucky to have a very, many of them are under-resourced, but I have a very good relationship with a good amount of nonprofit organizations, community-based organizations, and some mutual aid groups, but mostly it's nonprofits that already have very close-knit relationships with these communities. So, there's like, whether we're talking about senior centers or there's one organization that I cannot say enough about. I've known them for years. They've been an amazing partner. They're called POTS, P-O-T-S, or Part of the Solution. Very elegant in that acronym, I think. And POTS, they never closed. They were, they provide services to unhoused people, everything from pantry to soup kitchen, to legal services, to bathing, to barber, to medical services, to, they have everything under one roof. And they never stopped working, right? So when we could, we sent them resources, when we could, we helped them to clarify. I mean, there were so many friggin' issues also with fairly qualified health centers, for example, and some of the regulations, like there were so many regulations that since the governor was just issuing directives without the involvement of any of the stakeholders, basically for everybody, whether it was hospitals, federally qualified health centers, nonprofits, nursing homes, they basically had to be like, what do you want now? Okay. So I don't know if that's going to work. Okay. You need it. Okay. Let me get it. Let me figure out how I'm going to get it to you. So that was over and over again. So a lot of the work that I did in the immediate to as far as my constituency, it was having a relationship with those nonprofits, reaching out to them and being like, yo, how are you doing? How are you continuing to do your work? If you're continuing to do your work, how can we help connect you with resources? Like, and at the same time, then it was like acting as a go-between with the state to get clarity, to get, things changed, to, to demand certain things happen, to ask questions. Like that was what we were, that's what we were doing for most of it.
Yeah, again, it seems like with what you're talking about with like the versus working at the state versus the county level, just like going as local as possible, right? Connecting like on the most grassroots level seems to be effective. And
and also there, as far as there's many mutual aid groups that kind of sprung up, right? And reminds me, I was very inspired by some of the stuff because I saw something similar happen in Puerto Rico after the big hurricane Maria a few years ago, where the government, the central government of Puerto Rico and the federal government were a complete disaster. But there were so many different people who just figured out how to hacer de tripas corazón, and for those Spanishly challenged, that translates roughly as from guts to make a heart, right? So just figuring out how to get it done. And then, so these mutual aid groups did a lot of work all over the place that they just kind of sprung up and say, we're gonna figure out how to continue to get resources to people. And there's one that was started in Harlem that, even though it's not in my district, but because my significant other was one of the founders of it, then I started volunteering, and people didn't know who I was. I was like, I was wearing a mask anyway. It was like, I wasn't there in my official capacity, not wearing a jacket or anything like that. I was just like a big galoot that could carry shit. Like, let's just go, let's pull a cart up the hill to get food to people, and take it to them. So it's about having a relationship with local organizations that already are working, and then figuring out how to get information back from the state and to the state. But yeah, in making sure that the folks who are already doing the work get the resources so they can continue to do it, and not try to tell them like, let me tell you how you should do that. Like, no, they're doing it already. Just get them more stuff so they can continue to do the work they're doing.
what about, so, I ask you about your district. You're talking about, you've talked about the health disparities, the impacts, the fact that they can't stop going to work. What about evictions? Has that been a thing that has been affecting your community? And what has been the local response there? Like, what did the state of New York do? If they could do anything to stop evictions, what's been going on with that?
So I've been in the legislature for 11 years. And in that time, the number 1, 2, and sometimes number 3 issue that people come to my office for is housing related. Whether they can afford a place, whether they can stay in the place where they are, whether they have to fight with a landlord that's either trying to kick them out or not fixing anything, or they have to fight with rats, or all sorts of things, right? So I have a district that has roughly 67,000 units of rent stabilized apartments. This is actually one of them myself. I've always lived in a rent stabilized unit, except for a short period of time when I lived in a dorm room. And like when I moved here in 98. But besides that, as I say it often, I would not be able to live in New York and much less thrive in New York without rent stabilization. And I'm exceedingly lucky. Again, 5 people right upstairs. They're like making noise right now. The 2 kids that live over here. They split the living room. This is my living room. They split it up. They have a wall there. And in the back, they have bunk beds. So there's 2 kids that live like right here. It's just, I can hear them like all the time, which is, whatever. Anyway, so housing is an absolutely essential thing in my district, and very, very hard to find and very hard to keep. So we have been shook about the likelihood of there being eviction crisis just around the corner. We've been able to have eviction moratoriums that we continue to extend. And we've been successful in getting at least some programs up and running that have limited funds for the federal government. We have more coming in now, but we have been able to, for the moment, avert the worst of it. But since I have pretty scummy landlords that own buildings in my district, that means that there, for example, at one point, a constituent reached out to us, sent us a picture of a letter that had been delivered to them that said, all right, so you owe me 2 months of rent. Now, I know I can't kick you out right now because that's the law, but you should know that unless you pay me that 2 months, as soon as humanly possible as I can evict you, I will. So give me my goddamn money. It was more elegantly stated in legalese, but that's basically what it said. And this was a letter that was delivered to everybody. A version of it was delivered to everybody in that damn building. So that is an immense concern for people to be able to remain in their homes. Has been a very big part of this for us.
Yeah. So what do you, I mean, because those moratoriums are going to end at some point, right? Like, and so what, and I've, read stuff and heard stuff about people worrying that that's going to spark a real like crisis for these people who have, because I know in some cases, eviction like proceedings or whatever the relevant court proceeding has already been initiated. So they're just waiting for it to be legal. And then you're out on the street. Like what can be done, do you think politically, not necessarily even from the New York State Senate, but like what politically could be done to make sure that there's not a wave of poor brown and black folks who end up on the street like in the near future?
I think, well, there needs to be, I mean, capitalism. It's a very broad and complicated issue. And there are some policy approaches that can only be done at the federal level, as is my understanding. Because I will tell you that from the deep policy, in the deep policy world, right? I can dive deep into public health measures. Housing, I can only dive into like 6 feet. I can't do the 15. It's just one of the things that happens when you become, as you become a legislator, you become more experienced and more of an expert in certain things and not others. So there are definitely challenges to issues like the idea of canceling rent has been floated as a notion. And it depends on who you ask. There's different issues there about whether that's even a possibility, whether that can even be done. There are definitely resources they're necessary at the national level to be able to deal with this crisis. Excuse me, because it's certainly not just in New York, but across the country. And there is a legitimate concern that small or medium-sized landlords, people that own a home and have an apartment in the back, and they rely on that to pay the mortgage, and then they haven't been able to pay the mortgage because they don't get the person in the back. The person in the back's not working, and they can't. It's like, so we definitely have to be we have to be thoughtful about how we approach this. I think it's necessary for us to think about it in ways that keep people in their homes, and as we can, if there's enough resources, then make landlords whole, but start with smaller landlords first, as opposed to the big ones. And certainly start having a conversation about whether we think that this is the way that we should deal with housing as a commodity that is only available if you have enough money. So it's like healthcare. It's one of those things that we should, in some level, guarantee to people. Like I'm the wild commie. So, but I do think there's policy approaches, and we have to be thoughtful about it, because if not, it's going to be an explosion. So.
Yeah, and I'm sure that, I mean, the depth of that far exceeds what we could talk about here, but that is an interesting, just that notion of like housing for all is interesting. Will you give me 1 minute? Someone's making a lot of noise here. I got just 1 minute. I'm sorry.
Gotcha.
Sorry about that.
Don't worry. Did you shut him down?
Yeah, did what I had to do. So let's.
By the way, your camera was doing like your thing was going like it looked like it was in a plane for a second.
Really?
Like your camera was like.
Oh
doing
yeah,
like,
that could just be my jittery legs. So yeah, that's probably what that is. Let me pivot real quick and ask you more about just like the personal impact on you. So you mentioned in the pre-interview that you had, or maybe it was just a bit ago, that you have some sort of respiratory ailment, and obviously that is something that I'm imagining made you at high risk for COVID, severe symptoms. You seem like you're very what's the term, like outgoing, like extroverted person. I know politics is a business of, I don't want to speak for you, but that's the sense I'm getting.
I'm actually an introvert, believe it or not. I'm not even joking. Like I'm an introvert. Like I recharge by being by myself.
Right.
But I certainly when need to, I could definitely be the life of the party, but then at the end of it, I'm gonna come back home by myself. Like
right. Interesting. Yeah, wouldn't guess that. But well, and like politics obviously is it's a business of people.
Yes.
So for you over the past year, mental health, isolation, fear of contracting the virus, of getting very sick, the tragedy, like the sadness of losing people you care about. Just what has been the toll on you? Walk us through like some of the changes that you've had to go through just on a personal basis to adapt to the past year.
First and foremost, like when I always talk about myself, I never speak of my story of struggle. Instead, I always speak about my story of privilege. As I said, I'm like, both my parents were still married after almost 50 years of marriage. Both of them are high school graduates, each one of them first high school graduates and college graduates of each one of their families. I am college educated. I am a tall, male, cis, straight, light-skinned, white-passing, bilingual, educated, elected official. I mean, fucking come on. It's like and so I always, when I think about my life in public service, for me, it's always like, I always think about what there's an immense amount of privilege that I have, and I start there. Like I said earlier, I still have my house, still have my apartment, still have my job, never stopped getting paid, was able to continue to do a version of my job from right here. None of my family members, like some people who I care about, certainly passed away, but my family members, they were all healthy. So there's that. That's the first thing, that I never lose sight of that. Personally, I'm an introvert, so being by myself was not really that difficult. It was, however, for a very long time, the way that I function is I come back home to sleep, to watch TV or play video games in my 70-inch TV, which is my favorite thing. I just get lost in that bastard. And then I go to work. So I'm in the office, and I'm in the mentality of working in the office. Like I find it, so the being by myself in my house, I did not find difficult. The forcing myself to become effective in working from my house, that was difficult. That was a challenge, because it also, for a long time, my place didn't really feel lived in. It was just, I still don't have stuff on the walls, but like, whether it's I got it's cleaner than it's been since I moved in, because I actually did a whole reorganization. Everybody kind of did this at some point in the pandemic, I guess, if they had the opportunity. Like I cleaned out all my closets. I gave away a lot of clothing. I had an old couch that I got rid of, got a new one. I bought area rugs. I bought a table for the kitchen. For a very long time, the most important appliance in my kitchen was my toaster oven, because it is what I used to warm up pre-made food. I would burn water. But during the pandemic, I upgraded to a oven/toaster oven/air fryer, and I've been cooking shit. I bought a exercise machine called a tonal that actually is right on my wall, so I actually can work out like immediately when I wake up. Like it's right on my wall, and it's like the best investment I ever made. So now my place feels lived in, but the transition was a little bit, I wouldn't say rough. It's like, it's all about perspective, right? I always had, every 2 weeks, I got to check. And because I was stuck here, that means I went out once a week. During the height of the pandemic, I would go out on Saturdays. I would double mask, put on gloves, go outside, go to two places to do like I would pick up some, there's a place that one of my friends owns, this place called the Bronx Beer Hall. So I would go there to get beer. Then I would go to a supermarket to get food for the week. Then I would come back here and I would not leave for the rest of the week. So I would come out, I would go out of and when I would walk in, I would take off the gloves, I would throw them out, I would thoroughly wash my hands, take off both things, and then I would lock myself in here for a whole week. Like I was able to do that. So, getting to be effective, so I would start having meetings and, we did press conference, we did town halls, we did all sorts of things right with this setup. Well, I got a ring light, I got a microphone, to be able to set this whole thing up. So, that was a little tricky, but I wouldn't call it rough. Because I always have the perspective of how badly it went for other folks.
Yeah, sure, of course. What about, have you been vaccinated?
I am House Moderna, sir.
Nice. I'm a Pfizer man myself, but
you're Pfizer. That's nice. No, it's nice. So you should know that one of the things that happened was that at the beginning of as soon as the thing was available in New York, as the chair of the health committee, there's a lot of people who want to be friends and people who are friends who are like, listen, you want to get the vaccine? And I'm like, I'm not eligible. We're good. Well, thank you, but I'll pass. As soon as I became eligible, then I got it. But not before that. So
your respiratory thing it didn't put you in like a higher.
It would, except it's not as, I wasn't, very early on we're talking about, I was not a healthcare worker, right? I was not a nursing home patient. It's not, it's there, but it's not chronic. Like I don't have to carry a pump around with me. So it's like a lower level. Still, if I got it, I was at a high risk of it being bad, which just means that I was like really shunning the whole thing. The point is, as soon as I became eligible, then I was like, all right, then let's go. And within a couple of days I got it. So I got, I already have both doses, and I am encouraging everybody to get it, which reminds me, I have to text my nibbling. Do you know that word, by the way?
No, I do not.
Nibbling is a non-gendered term for the child of your sibling. So instead of niece or nephew,
interesting,
nibbling. And I have to, I just says, hey, gotten vaxxed yet? If not, let's chat. Okay.
All right. Good work.
Yeah.
Getting all of them. Yeah. Well, so what about your community with that? So I have spoken to different folks, especially I know with some indigenous communities, there's different communities have different folks have different reasons for not getting the vaccine. Some just can't, they haven't been able to. Others have different, either religious reasons or beliefs or whatever. But like access and communicating the effectiveness. Also, we've seen Black folks and brown folks also have reason to be suspicious of, this kind of stuff. So what's that like in your district, and how have you been involved with that?
Well, first of all, just a funny story. I had to break up with someone because she turned out to be an anti-vaxxer. So yeah. Moving on. The way that it's worked for folks in my district, excuse me, I'd have to check the latest numbers, but we have been dragging behind in the numbers, even though, again, we were some of the zip codes that had the highest rates of obesity, the highest rates of death and hospitalization, et cetera. Like we didn't, it hasn't matched up. Part of it, a little bit, was access at the beginning, certainly. At this point, there is no excuse. So at this point, I'm working to aggressively message to my constituency. We have, I've gone out there physically and like gone out with, there's a couple of federally qualified health centers in my district that are vaccination sites. And I've gone out and done, done like walkthroughs in the district with a doctor, right? I'm walking with a doctor and be like, a bilingual doctor, and be like, you got questions? You don't think it's real? Talk to this doctor who's wearing like her scrubs and stuff and her doctor badge, and then answer questions about the thing. I've done like a lot of social media around this stuff. There's like a Spanish PSA that I recorded. So it's like I've tried to get it out there as much as possible, but there has been some resistance and some reticence. It's not high enough. It's not too crazy low. So we're just lagging behind is the issue. And at this point, now we have and you've heard this already, right? That the demand is no longer outpacing supply. Now it's the opposite, right? Supply is outpacing demand. So I'm trying to make sure that while we still have easily accessible vaccination sites, because obviously there will be some retrenchment, right? As we don't get enough people walking in through the door on a day-to-day basis, then they'll start to actually, scale that back. And certainly I believe that we should as the time goes on, but I want to make sure that before we do that, as many folks in my district get vaccinated. So I'm doing everything I can to get good information out there. We've done like 3 town halls on this, including one completely in Spanish, which was very difficult because of all the damn terminology. Like I'm just used to saying the terminology in English and then saying the terminology in Spanish and having to do all the things, because obviously Spanish is my first language, but it's doing an entire town hall in Spanish and using special like the terminology. So I was a little challenging, but part of the jab.
Yeah, don't envy that. Yeah. Well, so is there like a common thread of the resistance you're seeing among your community? Like why are they not wanting to get the vaccine?
Lack of trust. They just ask questions about it, like what's in it, and what's going to be the effect 6 months from now? Like, why was it developed so quickly? It's the same type of stuff that's kind of been thrown around. And it's just about having the patients to answer the questions. Because all of those have questions. Like there are people who already been there who've had it for more than 6 months. The side effects have been minimal to non-existent when balanced out with the risk of getting COVID and becoming either sick or hospitalized. Like the risk is worth it. Like why was it developed so quickly? Well, it's a version of a respiratory ailment that has existed for a long time, and the particular methodology, the particular mechanism by which we deliver this, like the mRNA, which doesn't actually doesn't change any of your DNA, doesn't even get anywhere near the cell where the DNA actually is. That is a method that's already been under development for a long time. So it was just once we figured out what this virus actually looked like and what its structure was, then we could actually design a vaccine for it. That type of, all these questions, they all have answers, right? But it's just about taking the time and trying to get people the right information, and then repeating to them, like, not every source is a credible one. There's one of my my aunt's husband barely uses his Facebook. When he does, is to send me and my dad like just complete and utter anti-vax bullshit. Let me see what the last one he sent, because I was like, what are you doing? This is not, oh my God, where are you? No, this is not it. Hector, where are you? Okay, I'll see if I can find it, but it's like just crazy shit. So it's just about responding honestly, spending time with them, and hopefully being able to get them the right information.
Yeah, sure. And yeah, I have I had to block some family members from my social media because of that exact thing that you're talking about. You learn who they really are. So I'm trying to think. I want to get into this. Is Senator, is 2:30 a pretty hard cutoff for you?
2:30 was an hour and 15 minutes ago, because it's 3:20.
Oh, I'm sorry, 3:30 your time. Yes. Is that a pretty hard cutoff for you?
I can probably do a few. Let me tell Valeria to give us a couple more minutes. How much more time do you
No,
think?
that's fine. I'm just trying to, yeah, because there's a lot of cans of big. There's the nursing home question that might maybe go beyond the scope of.
Let me tell Valeria that I'm going to need a couple more minutes.
Okay, yeah, I'll ask you about that, and then just kind of close it up with sort of your thoughts on the priorities of the future. But yeah, I mean that's just so important, and I think anyone we're doing research on this time, especially about the impact in New York, of firsthand perspective in politics of what exactly happened, what is happening. Yeah, so give us your perspective.
Let me just write this to Valeria. It's like,
yeah, of course.
Give us a couple more minutes, ... at least 10. So I would hope that if anyone is looking at this in the future, researching what happened in New York during the year of 2020 of our Lord, during the Rona year, and particularly looking into the role that Governor Andrew M. Cuomo played, I'm sure that you will maybe looking at this, but I would much rather look at hopefully legal transcripts from investigations that were indictments that have been unsealed by our good federal government. I'm throwing this into the future. Wishing for it to be the case. Wish. So ask me a specific question. I wanted to lead with that because I hope, and I can almost guarantee that the unsealed indictments will provide a lot more information than what I could give you here. But tell me, how can I help?
Yeah. Well, so let's just go from the basics. So Cuomo is in trouble because supposedly he mismanaged this, and he lied about numbers related to nursing homes, deaths. I guess the base of it is that more people died in these nursing homes than was accounted for, and that the fact that they died in those nursing homes was due to his decisions. What can just walk us through the basics, I guess, of that, of what happened with the nursing homes and why Cuomo's in trouble?
Cuomo's in trouble because he is a garbage human, and it finally has caught up to him. It is not just that he mismanaged so many things around the pandemic while acting like he was the king, the smartest, the most brilliant person upon the earth that walks the earth. But also just there's allegations which I believe are credible from women about sexual harassment and abuse of power. I know for a fact that his abuse of power is just the way that he functions. I've been in the state Senate for as long as he's been governor, so I can tell you many stories about his abuse of power. But specifically as it relates to this, there's a few investigations that are happening. Let me see how I can sum it up. A lot of it has to do with what happened in nursing homes. Now, nursing homes, and anybody who paid attention to the science and would have probably just asked a few questions from stakeholders would have been able to tell you that this was the case. The people that are the most vulnerable are folks to this type of ailment are in nursing homes. They are congregate settings with people who are older, who are sicker, who are not that mobile. It could be a breeding ground for it, and ultimately it was. Partly the issue here was that at the very beginning of the pandemic, the way that deaths were being counted by every single state, including New York, for a short period of time, and we'll get to this. If somebody is a resident in a nursing home, is positive for COVID-19, and then goes to a hospital and tragically dies, then this death should be counted as a death from this nursing home. Now, why is that important? It is important because knowing that this person came from this nursing home helps us to determine when that person got infected, whether other people were infected there, what kind of protocols were established or were in place, what kind of safety procedures, et cetera. It could help us better understand how to make better policy. At the core of it, this has always been about like data, particularly when it relates to death and to health-related matters. Data is about understanding the issue so you can make better policy at the end of it, right? So at the very beginning of the pandemic, every state, including New York, counted this the tragedy of this individual as being a resident from this nursing home, but dying in a hospital as a death from that nursing home. At some point, New York stopped doing that. And all of a sudden, the deaths from nursing homes in comparison to deaths of nursing homes from other states were completely unaligned. So it seemed that the state of New York was doing something so much better than every other state, because all of a sudden, these deaths, obviously, how many people died in nursing homes? And there was this question about how many people died in nursing homes. And for months, we were asking the governor to give us clear information on this issue. And we talked to them private, and then we ultimately did a public hearing. We did a series of public hearings. The legislature is joint hearings. These are public, and those you can go to again, rely on the indictments. But hey, but you can go to those public hearings. There were 3 of them, and all of them were about the impact of COVID-19 on hospital and nursing homes in the state of New York. And they were hours long. At the beginning of the first one and the beginning of the third one, we talked with the Commissioner of Health, and we talked with him for like 3 hours or something like that on each instance. And we asked them questions very specifically about all these issues. And as we said then, it seemed that they were hiding numbers to make the governor look better. And they were insisting that they weren't doing that. And they insisted that they were going to get us the numbers. It's like they just wanted to make sure that they were correct. And they wanted to make sure that they were, that they checked on them, and they didn't want to double count. And they were doing all these rigmarole. And we're like, yo, every other state does it this way. Why can't you do it this way? Like, what are you hiding? So during last year, there was an August hearing. We asked him for this stuff on the record and publicly. He committed to providing this. He committed. He swore. He was under oath at the time, or at least he said, I hereby swear, whatever. It's like he said he was going to provide truth there. And we said, give us these numbers. And he said, I'll get some back to you within 2 weeks. Within 2 weeks, then we issued a letter that we then made public and said, hey, you said you were going to get us stuff. These are our questions. And we sent them a bunch of questions. And then for months, it's like, oh, we'll get back to you. 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 Then at the beginning of this year, and I think it might have been February, the New York State Attorney General, Letitia James, who had been asked by the governor, because at one point we were saying, like, what are you hiding? What are you hiding? And the governor's like, you know what? Attorney General, do an investigation. Why don't you do an investigation? Because I obviously got nothing to hide. And the Attorney General was like, very well. So the Attorney General, to her credit, did her job. And in the beginning of this year, around something like February, a report came out in which they took information from a couple of selected nursing homes, the Attorney General, and made extrapolations based on what they found on those nursing homes. And based on what they found on those nursing homes, as far as the difference between the deaths that occurred in nursing homes and the deaths that occurred in hospitals from former residents that were not counted, they found that the state might have undercounted the number of deaths from nursing homes by maybe up to 50%, 50. That report was issued at 10 a.m. in the morning. By 5 p.m. that day, the governor had upgraded his numbers, and it wasn't 50%, it was 44%. So within just a few hours, they magically appeared. They said, we've been, here you are, here are the numbers you were looking for. So obviously we were hiding nothing, but the numbers showed that the discrepancy was 44%. So for months, including by the way, when that distinguished visionary leader was writing his goddamn book. There's a book that you won't even find, hopefully, whenever you're seeing this in the future, that you won't even find even in trash heaps. It's not even the type of thing that's good for like starting fires, although they should all be burnt. Not all books, but these, at least they should be peed on. This guy wrote a book called American in Crisis, or Leadership in Crisis, American blah, 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 blah. And it has a very serious picture of him in black and white. And it has a red, white, and blue lettering. And it's just about American crisis, the things that we can learn. He put this book out last year when we were still in the middle of the goddamn pandemic. And we just found out that he's going to make $5 million from it. So while this person was in all of our living rooms every single morning giving this great speech in which he presented himself as the guy that led the state, that did the best, where least people died, where we did it the right way because we're New York tough and all that other crap that he was talking about, he was consistently ignoring the communities that he was supposed to be serving as far as how they actually would actually get to resolve things like we talked about, the testing and the vaccination. So consistently ignoring, not including stakeholders in making decisions that were going to impact, whether it was hospitals, nursing homes, of like nonprofits, federally qualified health centers, et cetera. Like, he just consistently going forward just to make himself look better. Wrote a damn book in the middle of it while people were still dying, made $5 million off of it. And I'm glad to say that now people are like, the shine is starting to come off the turd. So that's why he's in trouble right now. And he is under investigation by, and we are there's an impeachment investigation that is occurring right now in the assembly. I believe that, and right now means May 21st, 2021. I would hope that they goddamn do the right thing and that they present impeachment charges that go to the Senate so that we could be judges maybe in the future. This would have already happened. I'm sending it. But, and this was made public just a couple of days ago, because I was asked, and I'm not a liar, I was asked for a few reporters about reports. It said that I had been interviewed by the federal government on issues related to the governor. And the answer is yes. I was interviewed a few weeks ago by a total of 9 people, 2 FBI agents in the room, 2 FBI agents in the phone, and 5 US attorneys from the Eastern District in one room. Nobody puts that many resources into something unless it's serious. This guy is a garbage human. He does not do anything because it is the right thing to do. He does not have values or principles. He is a political thing that just does things to make himself look good and to be, to get political wins. So that is why, if you're a Cuomo-sexual, I will judge you. You should go get that checked out. That's just, give me 1 second.
Yeah, of course.
Hey, so is it 3:30 with you? No. Okay, good. Yeah, I'm still finishing the interview though. Can I call you right after? Yeah, no worries. I'll call you right after. Bye.
Yeah, and I can, one very quick question, and then I'll just have my last question for you. And this one, I don't know, this is probably more for me than anything. Do you think the Democrat majority Senate, state Senate of New York will vote to impeach?
Without a doubt. Without a doubt.
Really?
Without a doubt. The majority, there's a good chunk of us that have already said publicly that he should resign. Mm-hmm. And every single Republican would vote to impeach him. So mm-hmm. you have 20, I always forget how lopsided it has become, because I've been here for so long in the minority. That was crazy. That was just like, I was just like, banging my head against the wall. So we're 43 Democrats and 20 Republicans right now in a 63 person body. Mm-hmm. So the 20 Republicans, so what you need in a 63 person body, you need 32 people to vote in favor for something to pass, right? Which would mean also in impeachment charges. So you need 20 Republicans, you got all of them. And there's at least 20 of us who have already made it clear, because we have taken public stances that he should resign. And although I will certainly listen to whatever defense they got to make, this is somebody that I do not believe needs to be trusted with public power. And he should not serve in public office, and he should fucking leave. And so I know for a fact that the votes are there. If it gets to us, and by the way, something that you might not know, and I didn't, about the impeachment process in the state of New York, once it goes to once the impeachment charges are brought from the assembly to the Senate, then while the trial is ongoing, the governor steps down. The Constitution sets a standard, sets a process by which the lieutenant governor steps up to be the governor, while the governor steps to the side as the charges are considered in the Senate.
That's interesting.
Mm-hmm.
What a yeah, he embodies the how it started, how it's going meme. It would be fun to that.
Yo, I love it. I love it. I'm gonna do that.
Yeah, well, last question for you, Senator, is just sort of a more broad, just looking forward as things slowly. New York is opening, wasn't it like yesterday or 2 days ago that like a lot of the things started opening?
Yeah, I'm concerned. I'm concerned.
Yeah, I mean, I'm sure this, things aren't back to normal yet. People are, asking what is normal even going to mean? Is there like, what's the new normal going to be after this? But just, again, your work as a senator, you've got a constituency that you serve, a community that you live in and you care about. What are you looking towards to the future? Like, what are your priorities going to be for recovering from this, from building like power for your community?
I think that when we look at what the pandemic has taught us, or at least what I hope we have learned from it, is that the systems that have been put in place that are meant to serve us do not do that. Whether it's around issues of employment, whether it's just issues of housing, healthcare. Like, let's just stick with healthcare for a while, because that's the one that I'm going to be mostly focused on. But healthcare, the idea that we have a system in which, number one, we have an insurance companies at the core of it. So it is a profit motive that drives the decisions that they make, as opposed to your well-being or the well-being of anybody else who's insured. And second, that the system currently works, that it really depends on whether you're employed or not. And not just whether you're employed, but whether you're employed in the right place. Because you can be employed in a whole bunch of different places and have no coverage, and be employed in certain places and have kind of good coverage. It's like we need to move. So I would hope that what we've learned from this pandemic is that there's systems that are in place right now that are supposed to serve us do not, and therefore we cannot go back to normal. Cannot. There has to be a new normal. We have to just demand that we redesign this so that this is not the way that shit works. And so particularly on healthcare, the one thing that for me is at the core of the work that I've been doing that would be a culmination of sorts. And it would be like, it's the thing that I'm going to work towards. Like, it's a mic drop moment. It's to actually pass something called the New York Health Act in the state of New York. New York Health Act is a bill that I sponsor, and I've been sponsoring for the last about 3 years, that would create a single payer system in the state of New York. It's the idea of guaranteeing healthcare to every single New Yorker, regardless of their age, their wealth, their employment status, or their immigration status. If you're a New Yorker and you're a human, you're gonna get sick. So I believe that we should work towards a system that guarantees care for everybody. Do I care that folk in Texas should have the same right? Absolutely. I believe healthcare is a human right, and that we should move towards that. This country is kind of dead set on a path that just has, again, insurance companies and the profit motive at the core of it. And we have to fundamentally break that. And I believe that the state of New York can and must lead by setting an example and passing a bill that actually fundamentally transforms the way that we deliver healthcare in the state of New York, which, with all due respect to most other states, is not just some hunky, some rinky-dink state in the corner. We're talking about a very big populous state that can drives the cultural conversation, drives the media conversation. Let's drive the public health and healthcare provider conversation. Let's change that. So my goals, when I think about just overall, I think again that there's so many systems that just shown that they're not built to actually support people. And so we need to redesign them. And particularly around healthcare, I got a bill for that. And it's one that I think would actually, again, would fundamentally change the way that we deliver healthcare in the state of New York, and therefore provide an example to the rest of the country. Some history that you might not know, and I only found out when I got involved in this particular struggle. In Canada, for example, the single payer system that they have in Canada did not start as a Canada-wide thing. It started in one of the provinces, in one of the states, Saskatchewan. It started in Saskatchewan, and it was battled and, kind of resisted, but ultimately won out. And it was established across the country. And even though there's some things in their system that we're actually thinking about how to make it better in ours, the point is that a system in which everybody gets guaranteed coverage, they get guaranteed care, is one that we should move towards. So that's what I'm going to be working on.
Well, I hope you are successful, Senator. It's been a fantastic interview. Really a pleasure to speak with you, to hear about your perspective. I know it's going to be very valuable for this center and what we do. So thanks very much.
Absolutely, dude. Thank you so much for the invitation. You can hear my voice in the room there.
Yeah, it might be me.
Yeah, so thank you so much for the invitation. I'm like very like honored to speak to y'all. Honored to be living in the future.
Yeah.
Buddy in the future is going to see it.